Good morning, everybody, and welcome to our medical emergency preparedness sessions. My name is Kimberly Barrios. I'm with DeKalb Township, and I'm pleased that you're able to join us. So today we have a great lineup of speakers for you that are going to help you just prepare for emergency situations. Before we get into that, though, I do want to take a moment and just share a little bit of information about what DeKalb Township is and what we do. A lot of people in the community have heard of us, but I find that there's often a lot of confusion about our role. So to start with, as I stated, my name is Kim. I'm in the supervisor's office here at DeKalb Township, and I am the public relations and the events coordinator for the township. The township is a form of government that encompasses about 36 square miles. So we serve that population of people. We are larger than the city, but we're smaller than the county. And within DeKalb Township, there's actually kind of two divisions. There's the supervisor's office, which handles all of our general assistance and our special events. And then we have the assessor's office, which most people are familiar with. Separately, there is a DeKalb Township Road District. They serve the same area, but they are technically a separate legal entity. So information about what all three of those departments do is available on the DeKalb Township website. We do share a building, we share a website. We're located at 2323 South 4th Street in DeKalb. With that being said, as I mentioned, part of our function is to provide services and events to the community. And specifically, we seek to do that in a way that fills gaps in programming. And we love to collaborate and work together in partnership with other organizations. And so today, what you're going to see is really just a testament of that work that we do. As I mentioned, there's a great lineup of really knowledgeable, passionate individuals that are going to be able to share information that will empower and educate you, whether you are somebody who's maybe living with a chronic condition or illness, or whether you love or care for someone that does. So with that being said, I'm going to go ahead and turn things over to our first speaker, Jen Conley, with Northern Illinois Hospice.
As Kim said, I'm Jen Conley. I am a bereavement coordinator and music therapist with Northern Illinois Hospice. We're all grateful to be part of this presentation to gather and to talk about some important information. You will hear a lot of detailed information today, and our goal is just to hopefully invite you to open your thinking about having discussions that, while may be uncomfortable to have, are nonetheless essential to have. Having these conversations can help not only you, but your loved ones and the professionals who are assisting you. Right now, those of us gathered here, we have the luxury of time, and we may not always have that luxury. None of us want to think about needing to call 911, but it does happen. Nor do we want to think about going into a doctor's office and receiving a life-limiting diagnosis. That too happens. When decisions are needed to be made rapidly, we lose the opportunity for intention, consideration, and discussion. And the conversations you're going to hear about today deserve intention, consideration, and discussion. Making decisions about our own health wishes empowers ourselves, takes care of our needs, and it also is a gift to our loved ones. So we're grateful to be here today. I look forward to this opportunity, and I'm going to turn it over at this point to Dave.
Good morning, everybody out in Zoom land. My name is Dave D. Lilly. I'm the lieutenant of EMS with the DeKalb Fire Department. As Kim spoke of earlier, the DeKalb Fire Department does cover a lot of the DeKalb Township area. We respond to calls out on the tollway. We respond to calls at Northern Illinois University. So we're not just a city department. We are an all hazards department, which means we do cover fire responses. We cover emergency medical responses. We cover wildland fires or field fires or car accidents or wires down or any of those other types of calls. We responded to about 8,000 emergency calls last year. And the unique thing about, I think, somebody who calls 911, I don't think anybody really wakes up in the morning and says, you know, today I'm going to call 911. So a lot of what we're going to talk about today is things that you can do ahead of time, and hoping that you never have to call 911, but things you can do ahead of time to be better prepared if you ever have to call 911. And we're going to talk on these things. A lot of them are very simple things that you can do now. Again, just to be more prepared if that ever has to happen to you. Again, most of the time when people call 911, it is not a planned event. And we want to walk through some of the things that you can do today to better prepare yourself for that if it were to occur. One of the first things that we want to talk about is just having the ability to contact 911. There's a lot of people now that go into the hospital and are getting discharged. And maybe they have some limited mobility issues, or maybe they just have chronic mobility issues. So people walking around their house using mobility devices such as walkers and canes, if they were to fall, we want to make sure that they have access to call 911, be it a cell phone, be it a life alert type situation to where they have something, be it a necklace or a bracelet that they can maybe touch a button. So that is the first and foremost. Also, with the holidays approaching, if you are living by yourself, maybe having a neighbor or a family member coming to check in on you. So if you were to have a fall, or if you're having some medical conditions, that you have somebody kind of keeping an eye out for you, that they can help out and do that. So either arrange that, or if you have somebody living next to you that may need some of those things, maybe reach out and see if that's something that you can do to help. The other thing that we want to talk about with, it getting darker earlier, with weather kind of becoming inclement with the snow and possibly rain or sleet, is we want to be able to find your house or your residence quickly. And one of the things that you can do to help us with that is to make sure that your address numbers are easily identifiable. So if it's dark out or raining or sleeting, and we've all been there where we're trying to find something, be it a business or a friend's house, now put that into an emergency situation. And if you have a tree that's overgrown blocking your numbers, if you decided to paint your numerics on your house or your apartment to the point where they blend in with the background, it's very difficult for us to see that from the roadway. If you have a mailbox out at the roadway, if it's covered up with snow, or if those numbers and digits out there are not easily identifiable, that just makes it very difficult for us to find your house in a timely manner. And that is such a huge portion of what we want to do, is we want to get there timely to bring assistance to you. The other thing we can talk about is lighting. A lot of times just being well lit so we can find your house, turn on some exterior lights if you call 911, if you have the time to be able to do that, or have a family member do that. And again, if you have somebody that can come outside, flag us down, we appreciate any assistance we can to go to the right residence in a timely manner. Once we find your house, the other thing that we want to talk about is making sure that we have access to you. So if you're living by yourself and you fall, or if you're having a medical emergency and you are able to call 911, once we find your residence, we want to be able to access you in a timely manner. So one of the things we talk about is, if you don't have anybody that resides with you, maybe having a neighbor or somebody who has access to your house, be it a key or a code to your garage. One of the things that the DeKalb Fire Department has done is we've partnered with the DeKalb Township for a residential Knox box program. You may have seen these out there on some of the businesses in town. Usually they're kind of a dark brown or black color by the main entrance of buildings. This one here is designed for houses. And literally all it is it's a very secure lockbox that we can attach at no cost to you through the application process to your house. There's also models that can kind of go up and over your door. It's a keyed secure box that only we have the key for. And then inside you can put a key to your front door, back door, directions to get into your house so that we don't have to cause damage to make access. We will get into your house. Rest assured, we will get into your house. But if you have a mobility issue that maybe you're having some frequent falls, this is a way that we can come in there and not cause any damage to your house and still be able to come in and help you. So again, this is through the fire department with partnership with the DeKalb Township. If you have any questions about that, you can reach out to the DeKalb Fire Department and we can get you that information. So again, once we have access to you, another thing that we also talk about is if you have pets. When we get called via 911, a lot of times it's a very chaotic situation and people forget about the little things. So if you have cats or dogs running around your house and we're coming in there to provide medical care, obviously that hinders our ability to do that. The other thing is we do not want, when we open the door, to have your pets just run out. But we also don't want the pets to be interfering with that care that we're trying to provide to you. So again, if you have the time to be able to secure your pets into a back bedroom, It's just one other thing that we don't have to worry about with them escaping or with them interfering with the care that we're trying to give. Annette Mears is going to talk about some advanced care planning here after I get done, but one of the other things that we talk about is if you have any advanced directives or advanced planning in place, at the fire department, at the paramedic level, we really need to have those documents in place and available to us. So if we come out to your residence and you do have a DNR or a PULSE form that is valid and signed, we really need to have a copy of that form available, or an electronic copy available to us in order for us to follow the directive on there. We do not have immediate access to your medical records. So again, if this is something that you have, or if you're in a hospice type program, or if you're in a chronically ill state, and this is something that may relate to your current health situation, we do really need to have that information available to us if we do come out to your house and respond. So at the end of the day, these are a lot of just little things that you can do to maybe help us help you. And at the end of the day, that's what we want to do. We want you to be able to notify us if you need us. We want to be able to come out there and help you. And we want to be able to do that in a very timely fashion. And again, these are just some simple steps that you can do to help us help you. With that, I'm going to turn it over to Annette Mears, who's going to talk about some advanced directives. So thank you very much.
Sycamore Fire Department also has a Knox box program. They also will use the file of life document that's available. They'll be using the PULSE forms if those are accessible when they respond to a call. And anybody who's interested in getting involved with the Knox box program with the city of Sycamore would contact the city of Sycamore Fire Department.
Hello, everyone. My name is Annette Mears. I am a registered nurse with Northwestern Medicine, Kishwaukee and Valley West Hospitals. And I am the program lead of our advanced care planning and medical ethics. So our advanced care planning program supports our whole DeKalb County community. So all of the Northwestern facilities and our community as a whole. In the event that you reside in our area and you have a medical urgency, then you're going to come to our hospital. So we want to make sure that you have those documents, as Lieutenant Dave alluded to. So the advanced directives. So we help do what we're doing now, bring awareness to what is advanced care planning and why is it important. And then also we do appointments, which are free of charge, to complete those documents at the hospital. There's no limitations and barriers to this because we also provide translation services for any language. And we also have the ability to do these electronic technologies, Zoom meetings and calls. So if there's mobility issues, we can also get those documents completed and captured. So what many do not realize is that when we talk about advanced care planning, a lot of people think about it. They've recognized that about 80 to 90% of the population in the world, or at least in America, will talk about and have these thoughts and, oh yeah, this is what I would want, this is what I should do. But only about 30% of those patients actually get those documents completed. And then with that, it's even less of those, probably about 15 to 25% actually have those documents in their electronic medical record. That is the safest place for those documents, where they are actually accessible. As Lieutenant Dave said, they need them and we need them in the healthcare world. So I'm going to go through all of these different documents and how to help keep these documents accessible in your home and at the hospitals. So when you think about advanced care planning, now what really is that? We say take it backwards. It's planning for your care in advance. Here we are today. You wake up and you're in a healthy state, but you just never know what's going to happen throughout your day. You could have a traumatic injury or an event, or all of a sudden you have a medical condition that comes out of nowhere. Or maybe you do have a life-sustaining condition such as COPD, CHF, diabetes. But as we're going along our health journey and aging, our condition changes. We know that there is a prognosis and there's a trajectory, and it affects everybody differently. So that is what advanced care planning is, planning ahead. So how do you do that? You begin those conversations early. It's never too early. Technically, anyone 18 years of age or older can complete a power of attorney for healthcare document and should. And in addition to that, we should be reviewing it often. We have people come in and out of our lives who we point as the agent or successor, and also our health changes. So maybe what we chose today for guides of care could be different years down the road, or if I develop a medical condition. So when you begin that conversation, begin it with your primary care doctor, and then carry that conversation and share that information with your family, your loved ones, other caregivers. If you reside in a residential home, they're going to want to know your wishes. And always keep that conversation flowing. Again, it's going to change through time. So what we have here to show you is the power of attorney for healthcare. This is the form that we have with Northwestern Medicine. And you can also get it off of the Northwestern Medicine site, or you can get it off of the state government site. So there are 3 documents that we accept as valid documents of a power of attorney for healthcare. And that is the Illinois short form. There is the Jehovah Witness, and then there is the 5 wishes. The Jehovah Witness is specific to their religion. So if a patient wants to complete that, we'll help them complete it, but we ask them to bring it to us as we want to make sure that they're following their religious guidelines. And we want to make sure that we know that to honor and respect them. And then the 5 wishes is a booklet, and it has a lot of detail about, like, when we transition to, in our end stages of life, how you want your atmosphere to be in your environment, and specific details to the care that you would want or not want in just, basic activities of daily living. And then in the end of that booklet is the power of attorney for healthcare document. So as a legal adult with decisional capacity, you can complete this saying, who do I want to be my agent? It doesn't have to be family. It doesn't have to be next of kin. It's who you know that you respect and you trust, and who's going to respect you when you have to have decisions made. Being named on this document does not make anyone financially responsible. It just puts them in the position that for healthcare workers, we can call and say, this individual is here, you're named as their agent, so how on their behalf can we care for them the way they want to be cared for? So you have the ability to write your agent, and then you can list a successor or 2. Always important to at least have one backup person. Again, as mentioned before, people come in and out of our lives. If the named agent is not available, then we go down to the first successor or second successor. So we start with the first one and then we move down. And it's always important that they all know that they're on this document and that they should talk together too. When we complete this document, we give you back the original and copies, so everyone has their own copy. But the important thing about this document is we need to actually physically see it. So we don't necessarily need it in the paper hard copy, but we can have an electronic version. Thus going back to why it's important to have an electronic medical record, because it's housed there forever and we can always access it at any Northwestern Medicine building facility. We can pull it up and it will always be there. What's important though for our team members in the EMS world is that they have it accessible. So they have no electronic medical record access. I know that sounds really bizarre in today's world, but because of those HIPAA protection laws, for the sake of you, they do not have any access to medical records. So the more information you can give them out in the field, the safer and more efficient they can care for you. And they also have to follow this, because if we do not have these documents, then the law tells us that we have to go with Surrogate Act, next of kin. So when we talk about the Surrogate Act and next of kin, we say who is a legal substitute decision maker. So that's the umbrella term that we can say who is the legal person responsible to make decisions for someone else. And there are only 3 roles that can be defined in that. Power of attorney for healthcare, when we can visually see the document. A guardian, when we have a guardianship document that has been directed through the court system. Or if neither of those documents are available, then we follow the Illinois Surrogate Act, and then we appoint someone as the decision maker based on the priority list set by the law. And that does go through the next of kin lineup. So that's why these documents are so important to have accessible and available. Lots of people have them in a locked box, but we can't always access that. So what we do is we complete the document with you, and then we give you an important healthcare information folder to give you the opportunity to give some more details about your health and vital information, different caregivers that you may see. Not every line would be filled out, and that's okay. And then some personal information. As you come to the hospital in a crisis, there's so many other things that are important to you, but we're not focused on. So we want to make sure that we might have that information to help care for you the best holistically. Again, the paramedics would be able to access this. You'll keep a copy of your Power to Healthcare inside this folder. We guide you to keep it into a plastic bag. And then you keep it in a spot that's accessible. An easy spot is like your refrigerator or freezer. Sounds bizarre, but the bag protects from the moisture and it's easily accessible. It's never locked. And the paramedic team, they cannot be rummaging through someone's house. They have to have a guide to say, where is that? And that comes from our magnet here, which is saying, where my documents are located. And then also through the township, they also hand out the file of life, which also has another piece of paper here that gives another list of details of where your documents may be and other health information. So if you have these documents already completed, you can always access one of these, or you can reach out to us with advanced care planning. You can have both, because the more visual cues for the fire paramedic, the better they can care for you. So when we talk about one more other important advanced directive is the POLST. And the POLST form stands for Provider Order of Life Sustaining Treatment. A lot of historical is called the DNR, which is do not resuscitate. That is saying when I am found in a condition of no life, no pulse, and no breathing, I am dead. DNR, do not resuscitate, means do not do any medical interventions to try to get my heart started back up or get my breathing back, get any of my organs function again. That is the action of CPR, cardiopulmonary resuscitation. That's always those chest compressions. It's the breathing. That all leads to airway management, which is dropping that tube down the throat, putting you on the breathing machine, the ventilator, life support. Everyone has a different language to use with that. So you are allowed as the patient to complete this document if ever you feel that you do not want to have CPR done based on your health condition, your age, religious preferences. This is a medical order. So this needs to be signed by a medical doctor or an APN, which is an advanced practice nurse, or a physician assistant, PA. But you get the option to say, CPR or no CPR. Technically, per the law, everyone gets CPR unless someone brings this document to our friends in the paramedic world or at the hospital that says do not resuscitate. Per the law, everyone gets all measures done to sustain a life and to reactivate a life if possible. So if you select do not resuscitate in section A, because there is no life already, so don't be doing measures, then you have in section B the ability to say, do I want full treatment, selective, or comfort? So the section B, the fine print says, I'm alive, but I need to come to the hospital for something. Maybe it's just a standard procedure. I'm a DNR because I'm older and I know that I wouldn't want to have that risk of being, put on devices of medical interventions that aren't going to give me the outcomes of life that I want, the independent life that I've had before. So if I say, but while I'm alive, do everything to keep me going. So that would be called select or full treatment. Full treatment says do everything possible. If I become unconscious or I'm having a respiratory problem, go ahead and intubate me and do all that you can to see if these measures will sustain my life and recover this problem that I'm having. So full treatment is everything possible, saying while I'm alive, everything possible. Selective treatment, while I'm alive, only do certain measures. This basically is strictly we're saying do not intubate. So urgently do not come and intubate me. So if I pass out, don't put a tube in to support my airway unless you've talked me to my power return for healthcare or that I could maybe regain consciousness. Selective treatment allows you to come back and forth to the hospital, get surgeries, have different medications, have other means of oxygen support, which could come from a nasal cannula or a mask, but don't do the full extreme measures. Then there's comfort. Comfort is saying that I've either had a full life And, I know that I'm just really becoming older and frail. I know that, what I used to be able to do is now becoming limited. The activities that I enjoy in life are limited and limited. It could also mean that I have that life-sustaining condition that now is end stage. That my ability of recovering from an exacerbation of COPD is limited now. I have congestive heart failure, but I have to keep coming back to the doctor to get the fluid, maintained. I'm just keep filling up with fluid again. When you notice that these things are happening, the comfort care is allowing you to say, I can still come back to the hospital and get care that I can't otherwise get where I reside, but I'm not going to go to those extreme measures. Let's just help maintain my symptoms and keep me comfortable. If you're having the thoughts to be in that comfort zone because of your health condition, then we also recommend that you think about having palliative and hospice services. And so that's Jen Conley is going to talk a little bit about that in her field of work. And that doesn't mean that we're not treating. So a DNR, or even with DNR comfort, doesn't mean we're not treating. We're always treating for a patient, but we're only going to do the medical interventions and the care that you're wishing to have in that condition of health. So with that, I will pass the program over to Jen Conley to talk more about how we transition to palliative and hospice and what that means for care.
Hello again. As Annette said, what I'm going to do is now take the discussion into addressing some things around palliative and hospice care. We've talked about sort of a critical or acute situation, and that's addressed some things that are really important to have in place at any time, but certainly as we may develop a chronic condition. So I'm going to talk about sort of ongoing care, if and when that may be true. So there are times when treatments that have been deemed to be curative, that in some stages are essential and helpful, no longer become so. In fact, sometimes curative treatments, when there's intense side effects or a really compromised system, can actually diminish a person's well-being or even reduce the time that they have remaining. So I'm going to talk about both palliative and hospice care, and I'm going to do so by trying to address some myths that exist about it. So the first one is that palliative and hospice care are the same thing. So you could kind of consider them cousins, but they are not the same thing. Palliative care is a specialized medical care that helps people with serious illnesses or conditions manage pain, other symptoms, and help improve their quality of life. It can become, a person can get involved in that at any point in their disease progression. It helps with symptoms, it helps educate, helps coordinate care. It'll collaborate. A palliative practitioner or program will be in collaboration with your primary care provider and can also work among a number of healthcare providers to assist. So for instance, someone may have a cardiologist, an oncologist, a primary care provider, and that can get complex in terms of medications, needs, and so a palliative program can help educate. I'm a person who's non-medical, so I would need that. I would need somebody to help explain things to me and advise me and help me make decisions about what seems right for me. Palliative care helps look at the big picture. And it can be, a person can be receiving any sort of ongoing treatment or interventions while they are involved in palliative care. So hospice care, on the other hand, focuses on care, comfort, and quality of life when a person has a serious illness and may be approaching end of life. It includes physical, emotional, social, spiritual, if desired, support and care, as well as medical equipment, medications that support the diagnosis, supplies, and a highly trained team of caregivers. So those are some of the distinctions. Oftentimes the transition will involve both of those groups. So palliative care would be in communication with hospice care, again, to guide you in decision-making, answer any questions, help you decide what you want at that time, what your loved ones think is best for you, your needs, your energy, your well-being. So another myth for you, hospice care is only for the patient. So hospice is unique in my experience as a counselor in that I was used to having a client that we work with. When hospice becomes involved, anyone in that care or family or loved ones is sort of part of who is assisted. It's the entire care team or group that are assisted with hospice. And the support provided helps lessen the burden for loved ones, family members, and it also extends to typically 13 months past an individual's passing with bereavement care. So at Northern Illinois Hospice and many hospices have pretty robust bereavement programs, which provide a lot of programming and support. I have a little graphic here just to help demonstrate some of this. So this is sort of the beginning of a continuum where somebody may get a chronic disease or condition, and there's disease-directed therapies or treatments. So as that potentially may change over time, palliative care might become involved. So to help with that coordination and with assistance on decision-making, perhaps if it hasn't been done, some of the advanced care planning that Annette talked about. And again, anybody can continue to receive any sort of aggressive treatment or other interventions that they would choose to. Next on the continuum might be hospice care. So somebody is at a point where perhaps these treatments are no longer assisting them, possible that they may be weakening them or be so demanding to go out or go to hospitalizations, things like that. Quality of life, pain management may be a better option here. And then we have the bereavement care on the end of the continuum, which is for family members, loved ones. We've assisted professional caregivers in their bereavement. So that's sort of what that looks like in terms of the continuum. Another myth can be that hospice assists individuals only in the last days of their life. That can be thought about, or people might make that assumption because sometimes people enter into hospice when they are very acutely ill. But hospice, actually, the technical definition is a doctor's order that says a reasonable course would say a person has a life expectancy of 6 months or less. Now, having said that, people are often on hospice quite a bit longer because they may be getting such excellent care, or they have more of an infection that gets somewhat better. So that's sort of the guideline. But there has been research that has been done that shows that individuals with the same diagnosis, with same sort of situations, actually live an average of 29 days longer with hospice than those in that same situation who did not choose to have the support of hospice care. And the reason is multifaceted. So we're pain experts. So we get people out of pain. Hospice comes in and supports the whole family. It helps a person focus on what they want, surrounded by the things they love and the individuals they love, and sort of enhances the quality that they have in their days. And people sometimes rally. So that's something to keep focused. We never really hear people say, gosh, why did I sign up for hospice so soon? We always hear people say, why didn't I sign up sooner? And if you have any questions about hospice, there's always the opportunity for just an information meeting, a nurse coming out, answering questions, free of charge, no obligation, just to educate yourself. So that's something to think in mind if you were keep in mind if you were a loved one, just is curious and wants to educate yourself on that. Another myth is hospice is expensive. Medicare, Medicaid, and almost all insurances cover hospice care. And I'm just going to read these off because what's covered under that benefit is extensive. Physician services, nursing support, nursing aides, social work, spiritual support if desired, trained volunteers, all prescription medications related to the diagnosis, medical equipment, examples being oxygen, hospital bed, walkers, those sorts of things, wheelchairs, 13 months of grief support for loved ones, all at no cost to the patient or family. In addition, Northern Illinois Hospice and some other hospices have additional non-required support services such as music therapy, massage therapy, aromatherapy, pet therapy, additional support programs for veterans, sort of additional things like that. Another myth is that hospice refers to a location. It can refer to a location, but it's actually more of a philosophy of care. It involves the patient's entire support system. So nearly all patients are cared for in their home or the place that they call home. So that may be a nursing home, an assisted living, that sort of thing. The care team comes to you with the equipment, the medications, all the supplies, and that's covered under the hospice benefit. A few more myths here. Signing up for hospice means giving up other medical care. Hospice is definitely not giving up medical care. There is extensive amount of medical care that happens, medications and interventions to help provide comfort and quality of life and manage symptoms. This can include hospitalizations. For an individual, if symptoms are not being managed, then that person will stay on hospice, go into a hospital because we want to make sure that they are not in pain, are comfortable, and have the management that they need. It's to create the best quality of life, and the individual remains in charge of their decisions. Another myth, an individual cannot change their mind once they come on hospice care. Absolutely untrue. A person can opt out of hospice whenever they wanted. Goals change. Again, I referenced somebody may have had an acute infection and get better wonderfully. They can get to a point where they, discontinue or revoke would be the word we'd use. They choose no longer to be part of hospice. And then at any time, if their situation changes, they can opt back into hospice. So again, that's completely up to the individual. And finally, a myth that people think of is that hospice is this one big universal healthcare organization. And there are many, many different hospices, and not all hospices are created equally. So I would encourage you to do your research, ask questions, look at different things that an individual hospice may offer, have an information meeting, as I suggested. Like other healthcare providers, business models differ. Some programs are community-based and nonprofit, such as Northern Illinois Hospice. Many are for-profit. Just educate yourself, interview hospices, ask those questions. It's an intimate time and it's an important decision. So it's one that deserves, again, as stated earlier, some intention and some discussion. So that brings me to the last part of my discussion, which is this little deck of cards, which our organization came up with, called What Matters Most. And these were designed to help initiate or create an opportunity to have some of the discussions that we've been talking about today. So again, it can be awkward. As Annette said, many people, we have this thought like, oh, this is important. I'm going to need to do this. I should get to this. But then taking that leap from a thought to an action can be not only uncomfortable, sort of difficult, because I've talked with people who are like, well, I want to talk to it, but I don't think my adult children are ready. Or adult children will say, well, I want to talk with it, but I'm not sure mom how she'll take that. So, it's sometimes just opening that door to start those dialogues. So these are available here at the township, and we can also get them to you through Northern Illinois Hospice. But again, it's called What Matters Most, Cards to Facilitate End-of-Life Conversations. So there are all sorts of sort of discussion prompts on these cards. An information form at the beginning with some instructions. So read through the cards is what's recommended. Maybe the first time, just glance through them. Put them down, give yourself a little time. It's quite a bit of content. And then maybe go back, later in a few days, whatever's comfortable, and start to rank order them and choose perhaps the top 5 to 10 cards that resonate with you. And then finally, write them down on a piece of paper. And we also have a QR code where digitally those can be put down and then shared digitally with family members if that's something you would choose to do. So I'm just gonna read a few of these as examples to give you an idea. When we came up with these cards, a lot of people were sort of interviewed and consulted, people of different ages, races, cultures, walks of life, to help give us ideas on what do you think would matter to you? What stands out to you? So it's represents, I think, some diverse viewpoints. There are also some blank cards in here. And we know we won't cover everything because we are all unique and individual. So there's a place if something occurs to you that's not represented, then you should simply just add it. So some examples, I want more emphasis on my quality of life than my quantity of life. I want my pets taken care of. I want to be surrounded by things that I love. I want to be honored for being a veteran. I want to know my loved ones are taken care of and will be okay. I want to spend time outside or outdoors. I want people to know my special requests. I want my loved ones to know our family stories. I want to maintain my dignity. So those are some examples. There's a whole set here. So again, this is an opportunity to do some personal consideration and then say, hey, I was given or had the opportunity to have these cards and I really thought about it and came up with some things. Could we have a conversation about that? And this could be a doorway into then what are further action steps to take, like the advanced care planning or planning for care in advance. I love when Annette says that. So this is a tool which you are welcome to and we will have here. That wraps up my portion and I think we're just gonna all talk here for a minute and we so appreciate your time.
As Jen mentioned, that deck of cards is available here at DeKalb Township. The Five Love Life magnet that Annette mentioned that the fire departments use, that is also available here at DeKalb Township. And then generally when we do this presentation live, every person receives a folder that is just full of information. It's full of charts. It's full of literature. So many different helpful things that are in there, including a checklist. So this checklist is if you want to make sure that you are fully prepared. This encompasses everything that all of the presenters talked about today. So again, this is in that folder. So we just want to encourage you to stop by the township and let us know if you'd like to stop in and pick one of these things up. If it's easier for you to receive certain information electronically, maybe getting out is difficult, you can email admin@DeKalbTownship.org to request an electronic file of all of the literature, that checklist. And we can probably even digitize those cards for you, those discussion cards if need be. So with that said, we're going to go ahead and head over to our panel here. We've got some Q&A to get through.
So I was just curious, Annette, if I call and say I want to make an appointment to talk about these documents, what might I expect?
So you will make an appointment and we give the appointments about an hour time span. Some conversations are less, some conversations are longer. And you come in, you can bring whomever you want with. So that's a great question to ask, that the people that you put on the list do not physically need to be present. There's no additional signatures for them. But if you want other people involved in that conversation, that's great. We've also had times where we've done a conference call where the person comes in, but then they wanted, whoever else to be involved, but they couldn't physically be there. So we'll do a speaker or we'll have done a Zoom. So again, like I said earlier, there's just really no limitations. We just are so passionate that everyone gets these documents done. So, and then we just have a conversation and the conversation kind of involves how the patient in talking about the stories. A lot of them, as you go through the document, they share a lot of experiences, and that really does impact on how patients decide what kind of care they want, what they've seen in the media, historically through medicine, or what they've experienced personally with others. It's a good guide. Great, thank you.
Yeah, and I'll add to that for anybody who's interested in the month of January of 2025. And that's actually going to be at DeKalb Township most Thursdays and Fridays in the month of January. And we will be booking appointments here to meet with Annette here at DeKalb Township. So if that's a preferable location, you can dial 815-758-8282 to book your appointment. And those can be done at an individual basis, or if maybe there's a pair of like a couple who wants to come in and meet together, we can also do a single appointment for both of those people.
Yeah, that's a great point, because we have a lot of spouses come in together, or even like an individual and their child. We always say, would you like to do this too? And we have some people like, oh, I didn't think about that, but yeah, right. Because it is a free service, it's a great opportunity to get this done.
Yeah. So Jen, I have a question for you. You mentioned that people can go on and off of hospice. I think we've all experienced situations where a loved one is given maybe a terminal diagnosis, but then there's hope because some sort of a new treatment is available. It might even be something that's not fully approved yet, right? So can somebody in that situation who maybe is looking at a terminal cancer diagnosis, could they go off hospice and then receive this new treatment and then come back and go on hospice later?
Absolutely, and that's sort of where the communication between palliative and hospice would be important to make sure that that can be seamless. But yes, exactly a perfect example that you said, when somebody came on hospice, this may not have been available, or they may not have been aware of it. And so they can opt out. They, might benefit from palliative care where somebody's still advising and supporting and helping answer questions about that treatment, but get the treatment. And then, the story will write itself. They ideally, have positive effects. If not, whenever the time becomes appropriate, then yes, communication would happen and they could opt back into the services.
Then Dave, there's a question for you too. With that file of life, as an EMS responder, how is that a helpful tool for you when you show up to a residence? How does that tool help guide paramedics in the field to give care?
Yeah, I think like Annette talked on, first and foremost, it might point us in the direction of if there are advanced directives, where those are located, so we can follow the wishes of the patient and the patient's family. But a lot of times we go on calls and they may be nonverbal, they may be having a serious medical condition, and it'll kind of help us point us down a road on what is going on. Are they diabetic? Have they had a stroke? Have they had a seizure? Are there medications that maybe they're allergic to that we should not give somebody? Again, the list in the file of life is pretty large, and you don't have to fill that out in its entirety, but there are a lot of good suggestions on things that you could include in there to allow us to better treat you if you do call us. And the other thing I kind of wanted to talk about, I forgot to talk about when I was up front, is we talk about a lot of things here with chronic conditions, serious conditions, but with the fire department, we are really trying to get into preventative stuff on the fire side and on the medical side. So, if you find yourself living at home and your smoke detector's chirping, please call us. We would love to help you switch out batteries if need be. We don't want you to try to get up on a step stool, risk falling, hurting yourself. We are partnering after the first of the year with DeKalb Elder Care to do even a community paramedicine program. Again, so if there is a fall, it doesn't mean you have to go to the hospital, but we are going to start doing some follow-up on those calls to see if there's services that could be provided to make it so you don't fall again. And that might be something as simple as providing a residential Knox box so we have access. It might be help pointing you in the right direction for a life alert or some sort of other system if that's needed. And again, I think the biggest thing on that is just to know that there are things that you can do in advance to better prepare instead of waiting until 2 a.m. and something happens and you haven't made these simple steps to prepare. So we're in a very resource-rich environment. The township's a great resource for that. They have a nice booklet down here. So if there's other things that maybe people might need that we didn't touch on, I would encourage you to reach out to the township. You're obviously welcome to call the fire department. And we're trying to connect those dots of the resources that are available in the community to get those out to the people in the community.
Absolutely.
Yeah. There's an additional one I wanted to share too regarding the documents of a power of attorney for healthcare or the post. They are legal documents and they do not expire. We have had documents that have come in from back in the 1980s, those older do not resuscitate forms. As long as they are signed and dated and, the doctors signed it or on the post, or they've been witnessed on the power of healthcare, they are standing and they're living. So they do not expire. They're honored across state lines. So if you travel, we say take a copy with you. It's always just a really good resource of an emergency contact person. And what's really valuable is the healthcare system or our EMT system, they can access electronic versions. So if you present not with the paper, but electronic version, like on your phone, if you download it into a document file, or if you have your My Chart and you have the app, and then you scroll down to the icon where it says My Tools, hit that says Documents, My Tools, and then a whole menu pops up. And at the end, it says Advanced Care Planning. That takes you right into where it's seen on your portal in a regular PC, and that will have your post available or your power to healthcare again, so out in the field. So not only should you have it on file, but then also someone should be able to access it on your phone. So they have it on file too, again, just to give them a better visualization of really what are those preferences of care.
Yeah. And you instructed people to put that in their freezer. But am I correct, Dave? As long as they put on that file of life or on that magnet, clearly where that's indicated in the house, like they could tell you it's in their top dresser drawer and you would go pull that out of the top dresser drawer.
Yeah,
You're just not going to go on a treasure hunt to try to find it.
You're right. Yeah. If there's a visible magnet or something that's very visible to us that says, hey, come look at me, and this is going to give us some valuable information to help care for that person, we're going to obviously seek that out and look for that. We're not going to go search the house trying to find a magnet. And that's why we suggest, as Annette says, the refrigerator, freezers, usually a very visible spot for us. And again, the graphics on there are such that it's going to kind of draw our attention to it. And if on the file of life, you decide not to put it in the freezer or the refrigerator, you feel more secure leaving it in your bedroom or in your office, that's fine. Just make a note of that, or have somebody, maybe neighbor or family who's in the house, know where that is in case it is needed.
Yeah, great. And then another question actually for the both of you. So sometimes we hear people joke about having a tattoo that says DNR, or maybe they have a bracelet, possibly even a medical bracelet that says DNR. Is that legally binding?
We have to see the paper.
Okay.
And when we say the paper, like for us with the power of attorney, it has to be like all the pages of the document, right? Or at least, because sometimes we'll get like documents presented to us and it's just like fragments of the document. We're missing some pages. We definitely need to see that first page where it's listing the individual's name and who they appoint and signatures. The full document's great because there's parts in between that talk about like in certain situations, that living will component is in there, or, when the authority of decision making comes, but who and signatures make that a valid document. Thanks for asking.
Yeah, and then Jen, another question for you. So you talked briefly about bereavement. We didn't get real in depth about what that is. But you've got at least one event coming up. We've got your pillow making workshop. And then I believe there's also, you do some walks, guided walks. Is that correct? Can you just address the bereavement piece of what hospice does? And then maybe just share a little bit about those two events that you have coming up.
Absolutely. So thanks for asking, because one thing that's important to clarify, as a nonprofit hospice that's part of this community, our goal is to serve the community we're part of. So any of these things are open to anyone. So it doesn't have to be an individual that was served by our hospice per se. In fact, most of my groups, the larger portion is community people who heard about it through an agency or a referral from someone else. So yes, we have a variety of legacy and support events. So there's some groups. I lead a 6-week support group called Bridge of Hope. It'll start mid-January 2025, and the information I know is available on the township website. But those are 6 weeks, and they're kind of educational as well as more what you would think of as a traditional support group. Until somebody's gone through such a devastating and acute loss, we're not prepared. Nothing could have prepared us. And so there's quite a bit of normalizing and educating around that, just so people often say, I'm going crazy. And I'll say, no, you're not going crazy, you're grieving. And we sort of just validate that. And then, you know, people have opportunity for discussion. Grief can be isolating, but you don't have to grieve alone. So those are lovely connections are made in those. We have a non-traditional one, which you mentioned, which is a once a month walk at Sycamore Rotary Park during more summer or fall hours. We grieve differently. Not everybody wants to sit around a table or is comfortable doing that, but you know, being around people where you don't have to explain a hard day when you're grieving can be really kind of a relief. So there's a walk and a meditation sort of element to that, some mindfulness. And then we have events like the Memorial Pillow Workshop, which will be January 25th of 25. We co-host that with the DeKalb Public Library. People bring in a button-down shirt or t-shirt of a loved one. We have all supplies, very skilled sewers, of which I am not one, who give their time and create some lovely pillows that are of cherished clothing, and they're huggable, and they're sometimes just embody something that can be very comforting. So that is also free of charge. That one you register through the DeKalb Public Library. That's offered twice a year, the last Saturday in January, the last Saturday in June. And then we have annual memorials or different sort of, we've had ornament workshops around the holidays, so different legacy events, but all that information would be available on our website. And I have often had people who maybe we've served, but they live in, you know, Green Bay, Wisconsin, and I'll say, look up a hospice, you know, like maybe their mom was here, but they live somewhere else, you know, because often hospices do have things that can be a support and important and tender to assist people.
And thank you also for the lead-in on the DeKalb Township website. So I do just want to share that on the DeKalb Township website, which is dekalbtownship.org, we do have an entire section that's called resources. And that is just full of information about both resources, classes, and events that are happening in the community that are generally free of charge. Sometimes they're very low cost. But the idea of that page is really just to share this information. So any organizations out there who are offering free classes or reduced fee classes, offering any sort of valuable resource to the community, we would encourage you to send information to us so we can share that. And then you'd send that to submissions@dekalbtownship.org. And for those who are just looking to get information, we have our resource guide that is updated regularly. That's on that site. That is a topical guide. So if somebody's looking for rental assistance, or they're looking for food, or they're looking for clothing, or they're looking for resources on addiction or abuse, you can go to that online resource. But thank you so much again for joining us. We really do hope that this was educational and empowering, and that you feel more confident to handle a crisis situation should one occur.